Hi friends, I am Dr. Rajnish. Today I am going to start the lecture of anatomy, and I will study the upper extremity, means the bones of the shoulder girdle, arms, and you know okay, anatomy, how important anatomy is the most important subject of the medical science. That's why in the first year and first and half, means the second year, and we need to study near about 1.5 year for anatomy, because this is a too much difficult subject and also um, tricky subject, because anatomy connected link with or near about all subject of the medical science. That's it. That's why anatomy is the most important subject. And then I will try to summarize anatomy in a simple way. And my first priority to teach you anatomy, and how you can memorize name of muscles, arm muscles, nerve cell, blood vessels. Then let's start the study, and we are going to study about the shoulder girdle and arm. You know, in the shoulder girdle, how which first which bones come in mind? Just I can understand your smile. This is the first bone, is the clavicle. Clavicle bone is the most important bone, because this bone is also known as collarbone, because this is the presenter. This is my collar, and just behind this is called clavicle. Okay, so this is known as clavicle bone and also known as beauty bone. This is the one question of the exam. Which of the following is the collarbone? Called clavicle. Which bone is known as beauty bone? This is also known as. Okay, so two questions. So next, clavicular and clavicle and the scapula, backside of the scapula, the two are connected to each other, and when clavicle and scapula are connected to make a joint, this joint is called acromial clavicular joint. Okay, what is the name of joint? Acromial. This is the clavicle known as acromial, and this acromial, and this is the scapula region, acromial, clavicular, and acromial clavicular joint. Okay, that's fine. Next, this is the longer bone. This is the first long bone which are ossify firstly. Means the first bone which are ossify in the body. This is called clavicle. Okay. Second important feature. This is the only one bone of the whole body which have two primary center and one secondary center. Okay. Third point. This is only one bone, the longest shoulder bone, which are lies horizontally. Just remind this thing. All bones near about which are connected to vertically, but this is the only one bone which are lying horizontally. This is the exam question. Next, the bone which are ossify. This is the only one bone which are ossify with the membrane. This is called intramembranous ossification. Okay. Next property, these are connected link between appendicular and axial skeleton. This is also a most important point. Next, this is the common bone. What is the clinical manifestation? So this is the common bone. Yeah, this is the common bone of the fracture during child. बच्चे जब देखते होंगे, जब बच्चे खेलते हैं during the playing of the baby, the most bone, we always, when we are going to on the OPD, we will say which bone are generally commonly fracture. This is called plaque. First is, second is, during pregnancy and the birth delivery, during the time of the birth, when the first part head exists from the mother body, then we need to turn the head in the right direction. And then first we remove the what? It's called shoulder, which are connected with the pelvis. Okay, but if you are going to tilt a fast, then have tendency to break the pelvic. Means the commonest fracture of the child is called clavicle bone, and during birth also the common fracture of the clavicle. Okay, next, clinical manifestation of fracture. always ask in the exam ki what the site of fracture of the clavicle bone. We always remember two-third of median and one-third of lateral. And laterally one-third and medially two-third. So this is the important feature of the clavicle. Okay. Now we are going to write one by one and just to make the notes and then always do revision. Okay. The first one will go. This is the shoulder girdle consist of the what are the shoulder girdle consist? The first we will remember shoulder girdle consists of the two bone. One bone is called clavicle bone. Second bone is called scapula. Okay, the first is clavicle, second is scapula, and clavicle and scapula is connected with which joint? Which joint? Auricular means acromial. Acromi, acromi. This is called scapula. Clavicular, clavicular joint. Okay, fine. And what is the now we are going to study about the clavicle. What is clavicle? What is clavicle? So clavicle is also known as collarbone, also known as collarbone. Okay, it's also known as beauty bone, also known as beauty bone. Okay, have any problem? The collarbone, also known as beauty bone. This is the long shoulder bone that lies horizontally across the root of neck, just beneath the skin. How you write that it is a long cylinder bone that lies horizontally across the root of neck, just just beneath the skin. Okay, just beneath the skin. Fine. Next point. What is the peculiar feature of the clavicle bone? Next heading. Peculiar feature of clavicle bone. Okay. First feature. First bone to ossify the bone. First, what is the first? First bone to ossify in the body. Just mark. This is the question. The question, and this question came in the exam. Okay. What is the second feature? What is the second feature? Only long bone in the body lying horizontal. Okay. This is also question. Two clinical feature. And what is the next feature? Third point. Only long bone which ossify from a membrane is called intramembranous ossification. It's called intramembranous ossification. Okay, next point. What is the next point? Only link between the appendicular, appendicular and the axial escalator. The axial escalator. Okay, what will be the next point? Next point, the most, then this is the clinical manifestation. Clinical feature, CYF, this is called clinical feature. The most, now I'm going to change the color. The most common bone to be fractured, fractured in children and during birth. Children and during birth. Okay. What is the next feature? Next clinical feature. Next clinical feature. What is the next clinical feature? The most common site for fracture. The most common site for fracture. The site fracture is the junction. A junction of the middle third and outer third. Middle third and outer third. That is medial two third and lateral one third. Medial two third and lateral one third. Of how we remember which one is two third and which one is one third? So just to see lateral. Lateral means L. L. L you see just like a one. Just like one. One third. Which was lateral. Okay. And next clinical feature, it has no medullary cavity. This is also a most important point. This point also came in the exam. Okay. So this is the peculiar feature of the what? Clavicle. Okay. First bone to ossify in the body. Only long bone in the body lying horizontal. Only long bone which ossify from brain is called intravenous ossification. Only link between the appendicular to the axial skeleton. What is the clinical feature? The most common bone to be fractured in children birth. The most common site for the fracture during the pregnancy. Okay, during childbirth, and most common site for the fracture is the two-third lateral and one-third. The two-third of the medial and one-third. Okay, and there is no animal. Okay, fine. Now we are going to study about the which muscle. Okay, then I'm going to study the next point. You attach the muscle to the clavicle. Muscles, muscle attached to clavicle. Muscles attached to clavicle. Just to remember first point, muscle taking origin from clavicle. Which muscles are originate from the clavicle? Just remember T, D S S P D S S. Okay. P for pectoralis major. D for deltoid, having the anterior half. S for sternohyoid, and this S for sternocleidomastoid. This is called external head. So these four muscles which are originate from the scapula, sorry, clavicle. These are the four muscles which are originated from the clavicle. Okay. What are the muscles which are inserted in the clavicle? Next, muscles having insertion on clavicle. Insertion in clavicle. Just remember SIT, mnemonic SIT. S for subclavius. Okay, S for subclavius. T for trapezius. Okay, or I for insertion. Just to remember insertion, which muscles? Subclavius and okay. Just remember this is the point, and now we are going to study about the just to see the clavicle. This is the acromial head. This point is acromial head. Okay, this is the medial end. Okay, just if you go to study about this and how which muscles are connected to the which part, just we can see on the screen which muscles in the upper part. This is the trapezius muscles, trapezius muscle. Okay, this is the superior view, this is the inferior, this one is superior view and this one is inferior view. Okay, this is the sternohyoid muscles, sternocleidomastoid muscles, sternoclavicular muscles. Okay, pectoralis major muscle. Okay, sternohyoid muscle, sternocleidomastoid muscles, sternoclavicular muscle. Okay, trapezius muscles, then deltoid muscles, pectoralis major muscle. Okay, these muscles you can see the inferior and superior. Okay, I hope you know, I hope you recall each. Okay, just firstly I studied the clavicle bone, after then I will okay, thanks for watching.